Hi guys, this is Preeti and you're watching Mad Resolution. In this video, I'll be teaching one of the important questions from the university exam, that is the difference between the exudate and transudate. Exudate and transudate, this question is important from the inflammation and healing chapter and also from the hemodynamic chapter. This is the most important question. They may ask you under edema sub question also, they may ask you, and this is asked separately as a 5-mark question. These transudate and exudates are types of edemal fluid. Edema, you know, edema, and what is the difference between edema and effusion means there will be accumulation of accumulation of blood in a body cavity. Like if we consider this as lungs, these as lungs, the accumulation around the lungs in a pleural cavity is known as pleural effusion. This accumulation in any cavity, pericardial effusion, in any body cavity, accumulation of a fluid is known as effusion, whereas edema is in the interstitial place. Edema, pitting edema, non-pitting edema, all those, the accumulation of fluid in the interstitial space, that is in between the tissues, is known as edema. In the body cavity is known as effusion. This is the difference between the edema and effusion. This edemal fluid, there are two types, that is exudate and transudate. We'll see what is exudate and what is transudate. First, only you need to know about that, the mechanism. If you know, everything is damn simple for you if you know only the mechanism. Mechanism means how exudate is formed. Because of this increased, these blood vessels are lined by endothelial cells. There is a least space between these endothelial cells. If these is endothelial cells, the cells contract and then size is decreased, there is a formation of gap in between those, and then blood flows out of these capillaries, and that is increased. There will be increased vascular permeability. Exudate mechanism is increased vascular permeability. So all the blood comes out, all the protein will comes out, everything mostly everything will comes out in exudate. Whereas in transudate, this is nothing but ultrafiltration of plasma. You have studied in a previous classes also. Ultrafiltration means the proteins and the larger molecules cannot come out. This is the ultrafiltration of plasma, is a transudate. So vascular permeability will be normal. The place between the endothelial cells will be normal, but only there is a ultrafiltration of plasma. So if you know only this point, you can say everything. This exudate is during inflammation only it occurs, whereas this transudate anytime, like non-inflammatory conditions also it occurs. This is because of variation in the hydrodynamic rearrangement, that is increased hydrostatic pressure. There are two types of forces according to the Starling. This is due to the fluid, it is exerted by the exerts hydrostatic pressure, whereas due to the proteins present, mainly albumin, it exerts oncotic pressure. Hydrostatic pressure here more means water is more means it moves to the outside. No, so this is an outward force. If there are more solid particles, it drags the water inside. This is inward force. This is oncotic pressure. This more solid particles that are proteins, mainly albumins, it exerts 25 mm of Hg pressure, the oncotic pressure, that is oncotic pressure. So this cause for exudate is inflammatory. This is due to the change in the hydrodynamic rearrangement. This is a non-inflammatory condition. And because of vascular permeability, everything comes out. So albumin, fibrinogen, everything comes out. Fibrinogen is responsible for coagulation, so it forms it has a tendency to coagulate also. So everything comes out, no? So protein content in this will be high, whereas in this only ultrafiltration, so larger protein cannot come out, so it will be low. Mainly albumin will come out and no other proteins will come out. So it will be low. It will be the value will be more than 2 grams per deciliter in exudate, whereas in transudate it will be less than 2 grams per deciliter. And the glucose content, what is the glucose content? It will be low, because leukocytes also might have come out along with this fluid. Leukocytes are metabolically active, they consume the glucose, so the glucose content in the exudate will be low, whereas in this leukocytes are not there, so glucose whatever has come out, it is like that only, so this is high. And specific gravity, so I said all the proteins might have come out, so if the solid concentration is more, then the specific gravity is obviously more. So it will be more than 1.0020, whereas in this it will be less than that. The pH, albumins and all are there. This will be slightly acidic because everything has come out. There will be metabolism, so increased lactic acid, and then the pH will be less than 7.3, whereas in this more than 7. In the transudate more than 7.3. The LDH is very high in exudate because there are metabolically active cells, whereas the LDH is low in transudate. And the cells of the exudate will be leukocytes, parenchymal cells, and all the inflammatory cells. This is because of inflammation, no? So all the inflammatory cells will be there. Whereas this is not because of inflammation. So low, the cells will be low. That is mesothelial cells, only mesothelial cells, lining epithelium. The lining epithelium will be there, no blood vessels. That is mesothelial cells only. This will be there. And the ratio between the effusion LDH and serum LDH will be more than 0.6 in case of exudate, and in case of transudate it is less than 0.6. And the bacterial will be absent in exudate, whereas this will be present in exudate because glucose is there, no? In this glucose concentration will be high, so the bacteria will come and accumulate. If bacteria will be more here bacteria will be less. And the appearance, how it appears, this is a transudate is a ultrafiltration, right? Ultrafiltrated means nothing but plasma is a straw color, no? This appears straw and clear fluid, whereas it contains many proteins, so it will be white, yellowish color. This will be opaque because of this protein molecules, it will be opaque. And the examples for this is only thing which is left out, that is example for this will be pus. Pus is exudate, and pleural effusion. I said all the the fluid that is filled in a accumulation of fluid in the body cavity is known as effusion. In the lung is known as pleural effusion. This is known as this is example for exudate. Whereas in transudate, in congestive heart failure there will be edema. This edema contain the fluid transudate. This is the difference between the exudate and transudate. The exudate cause will be inflammatory, whereas transudate it will be non-inflammatory, and mechanism increased vascular permeability. Endothelial cells will be contracted, and there is a place between the two endothelial cells where everything moves out. Whereas in the transudate there is just ultrafiltration of the plasma, so only plasma will be there, straw color will be there. Whereas here everything comes out, so all means everything will be more specific gravity will be more here, and then because of inflammation, so all the inflammatory cells will be there, and then because of metabolically active leukocytes there will be less glucose, and then absence of bacteria because low glucose content will be there. Here bacteria, everything will be present. This is all about the difference between the exudate and transudate. If you find this video helpful, please do like, share and subscribe to my channel. Thank you.